Hey guys, Dr. Fink here. I want to talk to you about pediatric and adolescent populations since COVID. I want to talk to you about changes that those populations are going through in terms of posture. I want to talk about how it's affecting them physically and mentally. I want to talk about why that is, and I want to tell you what you can do to fix it, okay? So stay with me, let's get going. Okay, so poor posture. What are we talking about? Grab your child or observe your child. Just get a look at. Are their eyes level? Are their ears level? Are their shoulders level? Pay close attention to the shoulders in particular. They're a great gateway between upper back, the neck, and the back of the head. There's lots of evidence that talks about changes in shoulder height and then changes in forward head posture and in body posture in general. Turn the child to the side. Is their ear over their shoulder or does it pitch forward? Do they stand up straight or do they slouch over? It's not hard to do a really good assessment of their posture. Kids generally don't have a lot of trauma. That will come later, right? They don't have a lot of spinal mischief that we need to manage. And so we can get a good idea just by observing them, you know? One other thing you can do is turn them to the side, put them up against a wall. Can they touch the back of their head, the top of their back, and their butt to a wall? Or do they have to shift their head around? Does it make them uncomfortable? Are they making a face? You know the face they make. What I want you to do is make sure that they can do all of those things without any problem, because they should be able to. And if they can't, it's an indicator that something more is going on. If you're more interested in functional testing, which who isn't, you could do grip strength test on them. You could do pulmonary function. You can also look at digital postural analysis. You can get that done about anywhere. Additionally, there's the Y test. There's all these really cool functional assessments that we can do. But just observing them is often enough to give us a clue that something is going wrong. And if something is going wrong, we need to learn about all the ways they can affect our kids, because we don't want these subclinical assessments to just show up, okay? All right, so let's talk about what it does to them. Okay, so how did we get here? How do we get from not really talking about this or seeing it that much to where a 595,000 person study was conducted and 65% of the study participants, which is pediatric and adolescent participants, 65% of them had postural change or abnormalities, either shoulders or head tilts or scoliosis. How on earth do we get to a number that high? And why is it when we're walking around we see everybody doing this as they're younger? Their head's in front of their body, their spine is tilted. What's happened? COVID happened, right? We sent these kids home. They had to still learn, so they learned on tablets and they learned on smartphones, both of which produce a very unique posture, right? It's this. There are some people that have managed to modify it, and I'm proud of them, but for the rest of us, it's looking down. And so what you have is a generation of pediatric and adolescent kids that are doing this. And so their time on the screen went up from either 1.1 hours to almost 2 hours a day. That time directly takes away from the time they would have been outside or doing some other activity where they weren't looking down. So it's a double whammy. That time didn't go back down when the pandemic was over. They kept that screen time because that's what they learned was the right way and that they could get away with it, right? And now we're seeing the repercussions of that. So this isn't some kind of disease. This isn't another pandemic, but it's a whole lot of young people standing the wrong way. Cedars-Sinai had a really great paper last year where they talked about increased screen time directly correlating to changes in posture. And they're worried about it. They're suggesting some novel changes for getting these kids back up like this. The American Association of Family Physicians, same thing, except for they're reporting an increase in low back pain with kids. Either way, we've got a whole bunch of kids and a whole bunch of trouble. I want to talk to you about all the ways that this postural change can affect these kids, so we're on the same page. Then we're going to talk about how to fix this thing, okay? Stay with me. Okay, we've done a couple things so far. We've identified that there are big-time postural changes in our adolescent and our pediatric population, and those changes are likely a result of what has happened post-COVID. What I want to talk about now is what those changes are doing to these young people. When that head slides forward, when we have those positional changes like that, we see headache, We see numb hands, we see ringing in the ears, we see jaw pain, we see inability to sleep, neck pain, all of it. And these kids are very young. They don't have the trauma history to support these diagnoses or these symptoms. More than that, we see a decrease in pulmonary function. As that head comes forward, that person's ability to get air in and out quickly and efficiently goes down. Last week, I had a 16-year-old cross-country runner. Her head is about 1.5 inches from where it's supposed to be, which is pretty common. She has 71% of the forced expiratory volume that she's supposed to have. She doesn't move air as easily a cross-country runner, right? In a room of 100 people, all her age, her gender, her height, and her weight, 30 of them move air more than she does, or more efficiently. That's just not possible, right? There's something wrong. The other thing we see is a decrease in grip strength as we get pressure from the forward head on the nerves that control the hands. We've talked about that. The other thing we see is a decrease in that reaction time. I talked about a study the other week, first of its kind, right? As the head comes forward, the hand distance that the nerve has to travel stays the same. With the head moving forward, the speed is decreased. It's a big deal. And the research is really starting to coalesce around these notions. The last portion, and the most important, young people, as their head comes forward, develop low back pain or more neck pain, and those young people don't really want to be as active because they're in pain. Non-active young people run a very real risk of weight gain. So you have pain, sedentary behavior, weight gain, pain. Sedentary behavior, weight gain. It's a nasty loop that those of us as adults are fighting. So imagine these young people having to deal with this. It's a real problem. The aesthetics of having your head forward can generate a lot of scar tissue, and it doesn't look as good. I get these young people in here all the time, and they're concerned about how they look from the side. You guys got to remember, a camera is everything for these young people. We have to find a way to get that head back up so that they look as good from the side as they do from the front. It really affects their self-image, and it's just absolutely tragic. We even have to talk about this now, but it's happening all the time. If you go and look at some of these esports teams, it's almost rampant because of the large amount of hours that they spend with their head forward. I want you to be aware of this. So it's not just physical symptoms. There's functional change in these young people. This notion that if it doesn't hurt or if it's not in pain, then it's okay. That needs to leave. That's not helping anybody, all right? So what I want you to take from this, functional and physical changes that are going on with these young people, all right? It's something that we need to address, and we need to give them the tools to keep this from ever coming back. And that's what we're going to do in the next segment. All right, let's go. So now we know there's a functional cost to these kids, there's a symptom cost to these kids, and there's an aesthetic cost, right, to these changes in posture. How do we fix that? What tools can we give you and them to repair this and then stop it from ever coming back? How do we change the course of these kids so they grow into happy, healthy young adults as best we can as parents, right? Thank you for asking. I'm going to tell you exactly what to do. We're going to stretch and strengthen. We're going to engage some ergonomic rehabilitation. We're going to talk about movement breaks, and we're going to talk about screen time. Those 4 things is how we're going to build our bulletproof plan for these young people, all right? So let's get started with stretching and strengthening. Okay, stretching and strengthening. We're going to make this very easy. We're assuming young people, pediatric, adolescent cases, all the way up to teens. We're going to stretch the muscles of the front chest and of the neck. They're too tight. They've been rolled forward as this head's come down. We're going to strengthen the muscles that hold our shoulder blades together and pick our neck up. Both of those are very important. How are we going to do that? Real simple. We're going to do it with 2 poses based on yoga. What is commonly called the child's pose and what is commonly called the cat-cow. Those 2 poses are going to activate a lot of the core muscles and are going to activate the upper back muscles in order to get them nice and engaged and to engage in some stretch. We're going to do this first thing in the morning, last thing at night. 15 seconds, 2 times. Get your child on all fours, have them go through the cat-cow rotations nice and slow, then have them finish in child's pose. Okay, so I had this plan where I was going to demonstrate these stretches and these exercises and these poses. Who cares about that? What we have is a world-class yoga therapist here at Midwest Family Wellness. She will do a far greater job than I could ever do. So what Miss Kenzie's going to do is walk you through the way that you're going to walk your kids through these poses morning and night. As she's doing this, it's a little intimidating. Don't worry about that. Follow the flow she's going to outline for you, and you'll be great in no time. All right? They're all yours.
Awesome. Have your kids come down to hands and knees, tabletop. First, cue them to set their hands under their shoulders, knees about hip distance apart. Ask them to press through all four corners of the palm like they're trying to push the floor away from them. This helps to stabilize the shoulders. From here, find a small hug in the belly where you pull the belly button towards the spine. Once you feel stable here in the core and the shoulders, as you inhale, gently squeeze the shoulder blades together, lift the gaze and the tailbone to the ceiling. As you exhale, begin to round the shoulders, tuck the chin towards the chest, pull the hips, and then send the hips back towards the heels for this child's pose. When you're ready with your next inhale, you're going to lift back into tabletop. Squeeze the shoulders, lift the gaze and the tailbone. Find that nice arch in the spine. And then as you exhale, come back to that rounded position. Tuck the chin towards the chest, set the hips back. Continue to flow here. So inhale to come forward. This is your cow pose, the extended spine. And then as you exhale, this is your cat pose, rounded spine. And then hips to the heels, your child's pose. Once you've taken that flow a few times, have them rest in the child's pose. Walk the hands forward, lower the head and chest towards the mat. This helps to open up the rib cage, lengthen the spine. You can even walk the knees wider than the hips to help soften the tailbone. You can stay here. If you want to get some lateral movement, walk the hands over to the side. Maybe you rest here. Maybe find a little wiggle to help relax and open up the thoracic rib cage. Take it over to the other side, same little wiggle. Once that feels good, come back through center. Take another deep breath in your child pose. Really relax through the shoulders and the hips. And then inhale, lift back up. Set the knees underneath the hips, hands underneath the shoulders. Take a little wiggle left and right. Release any last little stagnant energy. And then when you're ready, your spine is good to go.
And so that's what it's like having a yoga therapist on call. And we have one here for the next time you're in the office. But what I want you guys to do between now and then is work with your children on just that, all right? She has a class to do, so we gotta go. I'll talk to you guys later. Bye. There's a reason why these work so well, and that's because of their total body engagement, and they're fun. Kids like doing them. Young people may not like them doing this much, but what do young people like really, you know? This is something that's going to help them. We can tie this into a lot of other things. What we want to get it to work with is what we call movement breaks. Movement breaks happen every 29 minutes while they're home. So they get home in the afternoon or in the evening or the weekends. If they're on an electronic, every 29 minutes they stop for a movement break. Movement break, cat-cow, child's pose, and then into our friend, the chin tuck. It's 3 motions that are gonna break up scar tissue, engage muscle, and stretch, stretch, stretch this front so we can get this child back up where they need to be. Those 3 things, in that order, done consistently, are exactly what your child's body's looking for, okay? So let's review. In the morning and at night, we're going to cat-cow stretch, and we're going to child's pose. 2 sets of 15 seconds. No big deal. Movement breaks are going to happen on the weekends and when they're home from school in the evening. And what's going to happen is they're going to do a wall angel. The wall angel exercises are very simple. Head, upper back, butt, feet, elbows and wrists, everything's on the wall. That movement break where they're stretching like that just for 15 seconds every 29 minutes. That is going to change the way their body is talking to their brain and start to reverse these postural changes. Cedars-Sinai had a great article where they talked about 6 months worth of stretching and almost complete reversal of some of these cases. That's the way to do it, right? Anything that we do once just won't last. We want it to go a little bit longer, a little more consistent. The way that we have found in this practice that works best is with cat-cows, it's with child pose, and it's with wall angels. Easy to do, easy to remember. You just have to tie them into those activities, okay? Okay, so we've talked about a bunch of stuff. The last thing that I want to talk about, after we talk about stretching and strengthening, after we talk about movement breaks, right? The pillars of rebuilding posture. I want to talk about not destroying our posture. I want to talk about screen time. When we're out with friends, when your young people are out with friends, doing their thing, hanging around, having a good time, they're likely moving around. The phone usage won't hurt them as much, right? Because they're mitigating a little bit of that by moving. The problem is when they and us are home mindlessly scrolling. It's fun, right? What I want you to do is build a nest or a fort or whatever you have to call it to get some compliance. I want you to find a spot in your house where you're often on the phone. Make sure it's got a wall, you know. I want you to put your back up against it, put your shoulders up against it. I want you to find some pillows, lots of pillows. I want you to stack them like this, then we'll put one here, then we'll put one here, and then we'll put something here so that it's wedged up against this. And now what we have is our butt, our shoulders, our head on a wall. We've got the left shoulder or the right shoulder, whichever, the outside of it's on the wall, and the elbow is braced. And now you can scroll, 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 and you're not going to hurt yourself nearly as much. Most of the time when we're doing this, this is where we'll spend extended time, right? This is the way to do it. And so I want you to find a place, help them find a place, make a fort out of it, and just have that be the place that they hang out. It could be at their bedroom, it could be wherever you like, right? What we're trying to do is build compliance. If they do nothing, nothing will change. We know what the results are going to be, right? We want them to buy in just a little bit. Just pick one or two things and make it real easy. Then add another little thing and make that easy. These young people are growing up in a world where all the information they could ever want is at their fingertips. And what we have to do is help them sort through it. And so what we're doing for you is making sure you have a bulletproof plan. And this is part of it. Somebody asked me the other day, we had fixed this young man, tall guy, and we had brought his head back 2.5 inches, right? And she said, "You must be so gratified doing this. It must be so fulfilling." And I'm telling you, it's wonderful. Being able to play any role in helping these young people not have to suffer like that, right? Oh my gosh, it's the best feeling in the world. If you would do us a favor, send this video, like, subscribe, follow us, any of the 50,000 portals of communication that we have. But send this video to your friends, anybody that's concerned about their child's posture. We've done our best to outline the dangers, talk about where the dangers came from, and give you some tools to help fix these dangers. And so we are very interested in your feedback. If you have anything else that you want to talk about, we'd love to talk about it here, okay? So I will see you in the office, and thank you for your time.